Hi, this is Dr. Jerry Hesch. I'm an orthopedic manual physical therapist. I have a bachelor's and master's and doctorate. I just never understood it, so I kept going back to school. I still study daily. I'm seeing something in this client I have not seen before. And I'm not going to spend much time on this video detailing her first treatment. She was the 1 out of 10 or maybe 1 out of 15 with an upper cervical injury in which the atlantoaxial joint lost motion because it was stuck at end range. We don't know if that's positional or just muscle tightness. It can be either or both. What's important is to be able to discern it and to be able to treat it. And it seems as though she, in her injury, the neck hyperflexed, and that drove the atlas posteriorly and downward to the best of our ability to discern with our hands. And we can debate that at length, you know, but my purpose here is to talk about what I observed with her. I was teaching her neck exercises in this device. It's called Dr. Reiter's, R-I-T-E-R-S, Real Ease. And I think he should have called it neck cradle. But anyway, so lift your head up and we'll put you in this one more time. Good, and then come down. So the curved piece goes under the neck, the flat piece points above the head. And she likes this device. People either like it or they don't. If they don't, we don't use it. We find another way to work on the neck. But this positions the neck in a little bit of its normal curve. And I was teaching her exercises. I have a video on these upper neck exercises, so you can type in my last name, which is spelled H-E-S, like Sam, C-H, upper cervical exercises on YouTube. And one of them she had particular difficulty with, and that was gliding her head, pure left and right side glide. Can you demonstrate that to us? Good. You can go and you side bend when you go to the right. Do a couple more of those. So you're able to go left and you do this weird little judder. Okay. So that cued me in. Let's take your head out of there. And for other people, if they don't like this, you could roll up a towel not quite as high and put it under the neck. And it tends to restore the mid and lower curve. And then it allows free and easy upper cervical isolation. That's what I like about this device. So I came and tested her, and it was too subtle with my prior screen. But now if I just slow it down and I come under the mastoid on the tip of the transverse process, I actually feel there's more tone on the right, but it's subtle. And I also feel like the sulcus is a little more shallow. Now I'm going to push on the transverse process of C1, also the atlas is the other name, and I'm going to glide it to the right. And you see how freely that glides in a pure plane? Okay? Now I'm going to do it to the left, except I can't. I think I saw a millimeter of glide and that's it. I can't glide it to the right. What do you feel like when I do that?
It just doesn't go anywhere, yeah.
Yeah, when I'm on the right, correct?
Yeah.
Yeah. So then I come underneath that at C2, you know, and all manner of, you know, people will say, oh, but there is poor intertester reliability of the palpation. I'm going, show me the study on palpation of the atlas. Because the atlas is right below the mastoid. The mastoid is so easy to find, and you come underneath that, and you may have to come a little posterior, you may have to come a little anterior. In this example, neither, and you get on the transverse process of C1. It's easy to find. In the mid-neck, I might be off by a segment. That's fine. I have no issue with that. If I can discern a joint that has reduced motion and restore motion in that joint, that correlates beautifully with a gain of gross range of motion, less sense of tension, less nociception, less pain. So it's a good thing. But we can't over-extrapolate our studies and say, well, you can't palpate C1. I'm like, show me the study. I don't think it was done on C1. All right. So this is just most interesting. And she does have some visual changes with neck positioning. I treated her a couple of weeks ago, and she had a different pattern that we already spoke about. And when she drives, her vision gets a little blurry. She hasn't had an opportunity to test driving since then, so we don't know how that's changed. But anyway, coming back to this side glide pattern, I want to treat it. And just a while ago, she was standing and we were doing some neck movements, and certain movement improved her vision, right?
Yeah.
Yeah, it was interesting.
Yeah, and immediate.
An immediate, yes, an immediate reduction of decreased visual acuity, right?
Right. It was sharper.
Yeah, nice, nice. So, you know, you could get a vascular workup. What would it lead to? I don't know. You know, so I'll just throw it out there. Mm-hmm. Later on, I will take a look at your balance and see if that's affected. And we could send you to a balance center or to a balance specialist. Some neurologists, you know, test balance, and then some have a specialty in balance. So that's out there also. But if we can improve this by improving movement, that would be wonderful. And I don't manipulate the upper cervical. I just simply refuse to do that. I treat it with very, very gentle force, and I am just very gently gliding C1 to the left with a little bit of right side bending. The metaphor I use is you want to open up space so you can shoot the watermelon seed out of your fingers. So I side bend to the right about 5 degrees because it's the upper cervical, and then I just work on gliding it, and I'm able to oscillate it in that direction. So I probably did that for about a minute now, and then I come back out of it, okay, and I feel a depth of the sulcus now, and now I can push it to the right until it stops, and then I can bounce it. So let's put your head back in here and see if that changes your active movement. Good. And now let's see you do the glide to the right. Looks very similar to the other. Can you go a little less far? Like cut it in half. And tell me how it feels.
Better, yeah.
It looks symmetrical. There is a little bit of side bending that happens when you do it, but you're doing it on both sides. It's symmetrical now.
And it's not confusing. It was sort of muscularly confusing to me the first time.
Yeah, because you couldn't do it.
Yeah.
So you had to substitute movement. Your body found a different pathway to get some movement over to the right, but it certainly wasn't a glide. Mm-hmm. Very good. I've never seen just a pure glide restriction, but we know that upper cervical anomalies are actually quite common. In one study, they occur in 30% of the population. There's a wonderful chiropractic journal that has a study in it on the upper cervical, and there's a book in anthropology, and they found more than 30% of Southwest Indians, and I forget the tribe, had significant anomaly at the OA joint and even at the AA joint. So we can go by the book and say most is supposed to do this, and you know, anyway, but when it comes to a person like yourself, you can't go by the rules. You know, supposedly your side glide should be coupled with rotation, but I couldn't discern any rotational restriction in your atlas. Mm. So very interesting. Let's have you sit up and see how you feel.
Well, Yeah, I think I feel good. Every time you would make a change,
Yes, yes.
I have to really adjust to that. And
Yeah, yeah.
mentally and dizzy wise and just, orienting my body in space again. It's almost like I have to kind of reset.
Yes,
that
yes,
way.
yes. Yeah.
But yeah, this feels good.
How so? What does good mean?
I feel very through here airy.
Airy. I like that.
Like it used to be concrete.
Wonderful.
And
Yeah.
now, I mean, I'm afraid, of course, to move. I'm sure I've learned that fear over the last 2 years.
Yeah.
So I don't make any like quick movements,
Right.
or I'm pretty gentle and cautious, but it does feel very fluid.
Nice. I think in time you'll just find out naturally that, well, it really is okay to move my neck.
Yeah.
I mean, some people will consciously try to, make the person overcome that, but I think it's a natural outcome of restoring the micro movement. And if I'm wrong, then, in a couple of weeks I'll see you one more time and then we can approach it a different way. But for now, I just like to let the body reveal itself.
Yeah.
Let the body make its own discoveries, because really, that's the best way to go.
Yeah. Yeah.
Good. Can you stand up and give me some feedback?
I would say the same. I'm just kind of readjusting to standing. One thing I notice after after your work is that I feel like there's a lot more light that I'm having to process in the room.
How interesting.
Yeah.
Interesting.
So it's almost like, where's my sunglasses?
Wow.
But I didn't feel that way, when I laid down.
Sure thing.
So.
Very, I like it. It's all positive.
Yeah.
I treated a patient and she swore that her acuity was better.
Yeah.
And she happened to have an ophthalmology visit scheduled. She went through the testing and there was no measurable difference. Mm-hmm. But it doesn't mean that it measures everything.
Right.
And I don't think it does, because she swore that her visual acuity was better.
I could have read all of your diplomas on the wall when I walked in, just as I can read them now, but I can see that the letters are sharper.
How interesting.
Yeah.
Well, this is very encouraging to me. Mm-hmm. I mean, we're going to watch this. I'm a little less inclined to say you need to go see an ophthalmologist, you need to go see a neuro-ophthalmologist, you need to see, yada yada. Mm-hmm. I do want to see you one more time.
Okay.
I think when you come back, we'll film the original pattern, the hyperflex pattern you had in the upper cervical.
Okay.
We'll save it for then and be able to get some more feedback. I would like you to drive a little bit.
Okay.
Okay? I know you haven't driven since we treated you a few weeks ago.
Right.
And that is a thing that provokes your blurred vision and so on.
Yeah.
So I think it would be nice for you to test it, and of course test it safely, in a safe manner.
Yeah.
But that would be good feedback for us.
Okay.
So thank you very much. Once in a while I see something I've just not seen before.
Yeah.
And it's possible that I wasn't sensitive enough to discern it in prior clients. But I certainly will be very careful in testing the side glide from here on out. And thanks for sharing this. We'll put it on YouTube, and maybe some clinicians can benefit from it.
Yeah. Oh, you're welcome.
And we'll also get some that will disagree with it, and I call them keyboard cowboys. They'll jump up and post their comments. It'll be interesting. Thank you.